Stacie June Shelton. I work with Unilever. I was formerly working on the Lifebuoy project when we were piloting this partnership with Sightsavers. But I have a current team that's in Kenya and wasn't able to make it, so I'm presenting on their behalf. So basically, the School of Five was originally a hand-washing behavior change program that showed some successes, and Sightsavers, we discussed with Sightsavers, could we then adapt it into looking at hand-washing behaviors together with face-washing behaviors. And so it basically focuses on the primary school age, and we have a very simplified kind of 4-step behavior change journey to deliver hand and face-washing habits. So this focuses on, based on WHO's recommendations for prevention and control of trachoma, we focus on the facial cleanliness aspect. And the objective is to increase hygiene behaviors and practice of hand and face washing with soap and address the F component. So these are the 4 simplified kind of steps of behavior change that we use. So awareness, raising awareness, why is hand and face washing important? Getting the commitment of the school children to practice the behavior, reinforcing the behavior, so 21 days of repeated practice of the behavior, and then reward for the practice. So just to show you where our materials kind of match up to the program. So awareness raising, we designed comic book stories. This was originally for the hand washing program. We worked with, so it's one of the, I come from a public health background, but joined the private sector about 6 years ago. And I can say that's one of the exciting things of the creative agencies that we work with, and just the materials that come out, really high quality. So we work with a comic book illustrator who does stuff with Disney and formerly with the Muppets, and came up with a story about key occasions of hand washing. It has superheroes and things like that to make it a very globally adapted program. And now we integrated face washing into that. And so we have stories that the teachers deliver to the students. Sometimes some students in some countries actually act out the stories, or they create puppets and deliver the stories in that way, but the stories have the messages in there about the occasions of hand washing and why. The commitment, there's a real fun pledge. I'll show you a film in a second of the kids doing a pledge that catches on, and they daily do this little pledge with the motions about when to hand wash and face wash. Then reinforcement, so reinforcement through 21 days of practice. There's like a diary, pretty kind of old-fashioned diary that I've seen used for years, but it is used as a kind of reward mechanism as well. So the diary is checked by the teacher at school as well as the parent at home. And children as agents of change, so the children themselves take this sheet home and spread the message out into their community. And both of these are also used as part of a reward mechanism for best school on returning filled out forms. And then there's some rewards, so a certificate, different rewards for best school, things like that. Let's see if this film will work, and it doesn't. It's not too loud. This is the pledge. So these kids, they knew this in Swahili, English, the local language as well. And this is, the pilot was done in Turkana, and this is kind of some of the key adaptations we made together with Sightsavers. We did some pre-testing of the materials in Turkana, and based also on some of Katie Greenland's formative research that I think she presented this morning on Turkana. We used some of that. And so we have a poster on the steps of hand washing. This is put at any sort of hand washing stations. I'll show you images of that. And then we had a specific chapter of the comic story dedicated to trachoma and preventing it. That were some of the key changes from hand washing to hand and face washing. Here's some steps of how we went through the process, piloting and then phase 1 again. So key stakeholder meeting, I think this is where the program showed a lot of success. There was a program already that UNICEF had done addressing hand and face washing in different parts of the county using peer educators in the school. And that county public health officer was very engaged and excited, and I think his leadership in taking it on board, as well as the local partner that Sightsavers had identified, the Diocese of Lodovar, having those local partners that were very engaged and the community trusted and the teachers trusted helped a lot. So stakeholder meeting with community leaders was big. Then we had a champion teacher training and a parents engagement, supervisor training so that there's monitoring going on, delivery of the material, then actually kickoff in the school, which could be take place in different ways, implementation, monitoring. The end of the program, day 22, is when you collect back those 21-day diaries, then rewards based on quantitative as well as qualitative criteria set at the beginning of the program to challenge all the schools and get them excited about implementation. And we had feedback from teachers and feedback from supervisors. So we had a master trainer who would then train one teacher from each school. That was the champion teacher. They would go back and train the other teachers. Typically these schools are really small. This was all in Turkana, and there was only 3 or 4 teachers entirely in the school. And then they would then deliver the program to the students. And then the program divided up over 21 days, but it basically breaks up into 4 weeks. So we just break up basically the comic book chapters over each week. They start the diary in the beginning. There's daily checking of the diaries and daily hand washing, face washing practice, and pledging. So Turkana was the county that was chosen because it had highest prevalence of trachoma in Kenya. It's being implemented in 116 schools so far, with Sightsavers as well as Fred Hollows. And like I said, this is focusing on the facial component. It was originally piloted in 10 schools. So that was in September 2014. And then we had phase 1 this year, 31 schools. And then phase 2 just finishing right now with 45 schools. This is all that's happening in Turkana. One of the big changes here were the stakeholder meetings. So we realized after the pilot how important it was to engage the stakeholders as well as the caregiver meetings. You can see a big increase from pilot phase to phase 2 of parents and sensitizing parents. So the champion teacher, along with their other teachers trained, would go out to either the church or Baraza or wherever the local community was already meeting and take the message, explaining what the program was and why they needed to support the behavior at home. So we did structured observations Sightsavers did structured observations at the pilot level, and we showed an increase in hand washing events, hand washing and face washing, as well as soap use at both structured observations in the school and household. There was about, I think the sample size for schools was around 1,000 and household level was about 300. So plans for scale up. Plans were to pilot in Ethiopia this year, but there's been some unrest and protests, so that's been delayed. Zambia, there's plans to roll out in 2017. This is the images of the child practicing the behavior at home and then the mother signing the diary. And then they're going to implement and scale up the program in 2 additional counties in Kenya, looking at new countries, Tanzania, Malawi, Uganda, and then evaluations to look at 6 and 12-month follow-up in each country.